Hello, I am Dr. Prateek Sondhi. I am a dermatologist and today I am going to talk about hair transplant. Balding and hair loss has become very common in men and we are increasingly seeing patients at an earlier age suffering from this condition. This leads to loss of confidence and self-esteem. Fortunately, hair transplant is a very simple procedure. It is a procedure with a very high success rate and a very high safety ratio. It is done under local anesthesia, which means that a patient is conscious during the entire part of the surgery. The first step of the process is to have a consultation with a qualified dermatologist or a trichologist who is well versed in hair transplant surgery. During the initial consultation, the donor area is reviewed and a patient is explained as to how much area can be covered during a single session. It is important to discuss this so that the expectations are set right. We can only take about 1/3 to 1/4 of the donor area because we cannot afford the donor area to look empty. After the discussion is done as to how much area can be covered, the next step is to have a hairline design, because a hairline design is very important so that the result looks very natural. After this is done, a few blood tests are done to see whether the patient is a candidate for the surgery. For example, a patient should not be smoking, he should not be having alcohol, he should not be diabetic, he should not be hypertensive, he should not be on any blood thinners. Once the blood test and the other investigations are normal, the patient is planned for the surgery. The surgery may take 1 to 2 days, may take anywhere from 4 hours up to 20 hours. During this procedure, the patient is conscious during the entire time. The most difficult part is to lie down for prolonged periods of time. So anesthesia is given, the head is shaved, the hairline marking is done, and then the next step is to make the slits. These are the holes in which the hair are put. It is very important that the slits are made in an irregular fashion, in a zigzag fashion, so that the eventual result is very natural. It is also important that the slits should be both horizontal and vertical in direction, because if the slits are horizontal, it can cause a see-through effect when anybody looks at scalp from this side. There also should vertical slits so that whenever anybody looks from the front, so that the see-through effect is not there. So a crisscrossing of slits gives the best results. After the slits are made, the next step is to harvest the grafts, and the third step is implantation. It is important that between the extraction of the grafts and the implantation, the time interval should be as less as possible, because the longer the graft stays out of the body, the lesser is their survival. So as soon as the grafts are taken out, an attempt should be made to put them to enhance their survival. The other important thing is that during the handling of this process, we should not touch the roots of the hair because they are very fragile, and the slightest trauma to the hair roots can damage them. Once the hair roots are extracted, they are implanted with the no touch to the root technique. So after the process is done, the patient can go home. The donor area is bandaged and the recipient area is left open. For 2 days, the patient is supposed to sleep straight so that the grafts don't get touched and they don't come out. On the 3rd day of the surgery, the patient is supposed to come back again and the bandage is removed. After the bandage is removed, the head washing process starts, but this process should be done without touching the hair. There is a special technique of the shampooing which is taught to the person, and that can be followed from day 3 to day 10. During this time, light physical activities can be started. After 10th day, again we call the patients to review with them if everything is all right, and on 10th day we start teaching them how to start touching the hair. After 10th day, there is no precaution whatsoever, and all those activities which were done before the transplant can be continued. After 10th day, when the hair are touched, there is a phase of hair shedding, but this is not to be worried because the stem cells are inside and it is the stem cells which grow new hair. So the shedding on process goes on for about 3 months. During this time, we can't really see much result. 4th month onwards, the hair start growing. In 6 months, the result starts to look good, and it takes 1 to 1.5 years to see the full result. So that is what I have to tell you about hair transplant. If you have any other queries, you may reach out to me. Thank you.